In spite of deflation in the economy generally, last week the VHI announced an average 8% increase in premiums for the coming year. Now, are we sicker than we used to be, or are medical costs running out of control? It's interesting to look at the cost of health insurance compared to the cost of living increases over the last few years. Now, over a period of 13 years, the cost of VHI has climbed by 264%, yet the cost of living over the same period has only gone up by 36%. Quinn went up by 15% this year, 16% last year. Aviva put up premiums by 12% in October of 2009 and by €128 for adults on all plans this time last year. This is Michael in the front row. Now, you had a procedure done through the VHI. Where exactly were you and what was done to you?
I was in the Blackrock Clinic in last July. I was in overnight. The procedure was called ablation. It's a surgical procedure on the heart, which is.
How long was the operation?
From the time I left the ward till I got back was about 2 hours.
2 hours.
So,
and you were in one night? One night only?
One night in a semi-private room with three other people.
What was the bill for one night?
The bill for one night for the accommodation and ancillary services, not including the surgeon, was €17,214. So I wrote to them on the 3rd of September. In mid-November I had heard nothing. So I wrote to them again, and at that point I threatened going to the public. And I then got an
explanation,
a telephone
that you had to have 2 radiographers standing by, you had to have defib available in case you snuffed it on the table or whatever, and you had to have this, that and the other, and it all added up to the princely sum of, well, what they were paying was 17,000.
Yeah, in fact 17,214 was what the Blackrock Clinic were charging, and the VHI told me that in a fixed price deal they were paying roughly 15,500 of that.
I transferred from VHI to Quinn, and last year I had a very difficult year. Both of my parents died within 4 months, and I lost 2 jobs, so I had no choice but to give up my insurance. I feel very conflicted because on the one hand I feel very vulnerable because I don't have insurance. On the other hand, I feel it's absolutely awful that I should expect to be put ahead of anybody else.
McMahon from the Irish Patients Association. Stephen, the experience that Michael told us about, how common is that?
Well, it's just the whole problem with the whole private health insurance sector, that it's very hard to understand the input costs to what the members are actually paying. We need to understand, is it that we're paying more for doctors? Is it that we're paying more for the facilities? How are these costs being challenged? That's something we're addressing in the near future.
In that 13-year period, over the last 5 years, the number of medical procedures we paid on behalf of our membership has gone up 73%. If I take 13 years, I'd be pretty certain it's gone up about 150%. You have technology, but you also have a very significant increase in utilisation. And there are people that are having procedures today that regrettably would have died 10 or 15 years ago. You need human beings to deliver top-class healthcare, and you don't get the conventional economy scale. The second thing is the rate we're paying per consultant is coming down. It came down last year, and I anticipate it will come down further. So the actual rate that the consultant is getting is less per procedure. The primary driver of medical costs in the last 15 years, 20 years or 25 years, this is not unique to Ireland. This is a worldwide phenomenon, is more people accessing healthcare. We have with us Donald Clancy of Quinn. He's the general manager of Quinn Healthcare. Now, Donald, you are in it for profit.
Absolutely.
You wouldn't be doing it.
We're a commercial company and organisation that operates for profit. We don't apologise for that in any way whatsoever. We're
but you
also operating
are increasing your fees, as we mentioned.
For example, the price increase of this year would not have taken place if we weren't paying the stealth tax that goes towards the inefficiencies of the VHI.
If you had their age profile, you'd be screaming blue murder, looking for more dosh, because you couldn't make a profit if you're looking after most of the over 80s, most of the over 70s, most of the over 60s.
First of all, no matter what age category we're talking about, we are between 20 and 50% more efficient than the VHI for our claims costs across any of the age categories. be it, never mind a 70-year-old, an 80-year-old or anything else like it, I'm talking about 30-year-olds, I'm talking about 40-year-olds, we are still significantly
But you have the
more
reputation of being a
efficient.
bit tight about settling claims. Is that true?
Not in the slightest. By VHI's own admission, they have paid millions out that they should never have done in the first place.
And you don't?
We do not.
Are you forensic about every claim?
We are not forensic about every claim. We are fair about it. Since Quinn have come into the market, and they've done it in other markets other than the healthcare market, and given a chance, if VHI were operating in a competitive market, and if we had the ability to operate in a competitive market, we would bring down the price of insurance as we have done in
Jimmy,
other
do you
markets.
believe that?
I don't believe one word of it, Pat. So, I mean, the reality is absolutely different. Quinn is for profit, and for profit means you focus on younger lives.
16%.
Are over 40?
No, over 60, sorry.
Or over 60?
Yeah.
That's not, Pat, that's not correct. 6% is over the age of 60 in Quinn. So if it was 16%, they would not have to pay any TRS.
Yes, Jimmy.
And I would just take, Jimmy said that number one was that the healthcare, the hospitals, and these had all gone up. I had a stroke in Holland. I spent 5 days there, and the total in the top Centre of Excellence for Neurology.
Were you insured?
Yes.
So what was the bill?
4,600.
Wow.
I came back and they discovered that I had a heart problem. I had to have an implant put in, which is pretty straightforward. And I got the bill and I put it down, and it was 19,000 for 2 days.
Are they all as bad as each other?
I don't think that's the starting point, Pat, and I'd like to take a step back, because most of the comments here tonight so far have been about the half the population that have private health insurance, apart from the woman who spoke in the front row. And just to make the point that we have a very unequal, complicated system of healthcare. We're absolutely unique in Europe. Most health systems in Europe have universal access that's based on need and not ability to pay. What we do in Ireland is not only do we allow the people who take out private health insurance to skip the queue, but then we subsidise large amounts of private healthcare with public money. Once you're in a public hospital system, even as a private patient, 4/5 of your healthcare is paid for out of public money.
Yeah, but if you're a taxpayer, I mean, if you're someone who jets in, that's one thing. But if you're a taxpayer, you're entitled to all of it for nothing.
Yeah, but the point I'm making is that everyone should be entitled to quality access to healthcare on the basis of need, not ability to pay.
You know that the two main opposition parties favour a system of universal healthcare, where the money, whether the person goes to a private or a public hospital, the money, the insurance money, whether it's a state insurance policy or a private insurance policy, follows the patient to the best place.
Yeah, and we're at an interesting point, because we've never in the history of the state had all opposition parties interested in universal access.
Do you think, though, that Jimmy could do better deals? Do you think that all of the insurers could do better deals and make it more affordable for people who want that parachute I mentioned earlier?
I can't answer that question, Pat, because we just don't have the facts and figures. Private hospitals won't give us the facts and figures on how much they charge. Private health insurance won't give us. So it's not possible to substantiate that point.
Dr. Ian Morrison is here somewhere.
I couldn't really agree with Sarah Burke more, really. I suppose the way I would see the problem with the cost of health insurance would be that there's a simple way to end it, and is actually properly fund public health care. What happened is that the older, the sicker, the people with pre-existing conditions just won't be able to get insurance. They'll be just priced out of the market.
And what's happened is we have built up the public health system. We've quadrupled health spend, and there are some improvements in our public health system. But while we've done that, we've quietly incentivised and privatised large sections of the health system.
There's a safety in switching the cover from one insurer to the other, and in fact the savings can be made without changing the quality of their cover.
Dolores Ferris, why is VHI so important to you?
My circumstances have changed drastically in the past 12 months due to my husband's illness. We are VHI members for the past 30 years. I cannot afford to give up private health insurance. Now, I have already looked at quotes from Quinn and Aviva, and I can get it for €400 less than I'm paying VHI.
But would the public service not deliver you the health care you require?
I'm afraid, Pat, that it won't. I can't take that risk. My husband got an angiogram in the Mater Private because there was nothing available at the time in the public. He had gone in as an emergency patient and was brought by ambulance from the Mater Hospital to the Mater Private, and we got a bill for that for €297. Like
from
100
the
yards
public to the private, 297. Yeah. Oh, come on.
Right.
It's mad stuff.
When you query a cost like that to VHI, the attitude is, it's like when you've got car insurance. Actually, what are you giving out about? we're paying for it. That's wrong. They're not practising good housekeeping, the same as every housewife in this country is having to do.
There's a certain sense here that private healthcare is good or better than public healthcare. The reality is that if you're very sick, you're probably better off in the public health system, and that's true in Ireland.
End up for a lot of conditions in the public health service because there won't be a private equivalent.
They won't deal with strokes. They won't deal with a lot of neurology cases, psychiatric cases.
Jimmy, I want
so
to give you the last words on this particular.
I mean, firstly, I'd have to disagree with Sarah's last point.
Well, of course you would, but that's because you...
if you can afford me the opportunity, 70% of our customers' care is actually delivered in private hospitals. Psychiatric care is a Cinderella service within the public system. Anyone that says it isn't is in an interesting point. The 2 psychiatric hospitals, the tertiary care, deliver superb services, and we're the only health insurer, and I call on Donald to do this, we're the only health insurer, or sorry, Hibernian does it, but that does not deliver, you do not deliver tertiary adolescent psychiatric care. Why don't you deliver tertiary adolescent psychiatric care? Because it's more expensive than ordinary psychiatric care. You do not deliver tertiary.
Suite in St John of God's. Sorry, I don't know why this is specifically being pointed at me, but absolutely we do.